My name is Ben Sutter. I'm a general dentist in Eugene, Oregon. I'm a diplomat in the American Board of Laser Surgery. I do implement the CO2 LightScalpel laser in my office. I use it for a number of things, mainly infant and adult tongue tie and lip tie releases, for crown lengthening and adjunctive periodontal therapy. I can't say enough about how easy this is to use and how easy it was to learn. And of course, once you get your hands on it and you start to play with it, you can't practice any other way. Having used other instruments in the past, the CO2 laser from LightScalpel is my workhorse. It's used, if not every day, multiple times per week for sure, and that's building. Patients enjoy the technology in the sense that this is not a scalpel. The healing is better than with a blade, that there's no bleeding, that the inflammatory response really isn't as great. There's not a lot of heat and redness around the area where you're working. And I think that's something that all patients can appreciate, especially if you have to have the procedure. I can't recommend it enough. I'm actually being sought out for this. The office gets calls from all over the West Coast, and actually we've had calls from France, we've had calls from Albania, who does what you do where I live, gets asked multiple times per month, and that's kind of interesting, and people are traveling for this. I think part of that is because I make videos just to educate patients on what it is that I do, and once you see a patient go through the process, share with their experience and how that's changed their life, it's easy for other patients to say, wow, that's me, I suffer from that, and I want to fix it if I can. That's been an interesting part of bringing new technology into the office and being able to serve my community better.